What's the #1 disease among children in this country? Most parents would never guess. It's tooth decay. The nation's pediatric dentists want you to know just how serious this problem is and what you can do to prevent it.
Early childhood caries is a crisis. It's a silent epidemic.
It's 5 times more common than asthma. It's 7 times more common than hay fever.
Currently, I have 40 children waiting to go to the operating room that have baby bottle tooth decay.
We can't keep up with the number of children who need to be treated in the hospital under general anesthesia as young as 2 and 3 to fix all their teeth. So that can't be the solution, to keep fixing the teeth and waiting for the damage to occur. We would prefer to prevent what is essentially a preventable disease.
It's what we're feeding them. It's diet, and sometimes it's the lack of oral hygiene at home.
What many parents don't know is that if you have tooth decay in your mouth, you have bacteria in your mouth, you're introducing that same bacteria to your child's mouth.
So blowing on the food, tasting the food, a dropped pacifier that you might pick up and clean off, rub it on your clothes or put it in your mouth, and you give it back to the baby. All those things can infect that child.
If a baby is put to bed with a bottle, for example, and the bottle has milk or apple juice or something that has sugar in it, the constant exposure of that sugar to that bacteria will allow them to keep making acid. And that acid that they make is what causes the teeth to sort of dissolve away.
The issue is that formula will pull around those front teeth if you give them the formula and immediately put them to bed. So yes, we caution them on not to send them to bed with that or even breastfeed on demand all night. Unless you take a toothbrush or a cloth and wipe the teeth back off.
Just because the baby doesn't have teeth, it doesn't mean you shouldn't clean the child's mouth out, that the child's mouth should be wiped out. That once the teeth come in, that you should start using a tooth aid or a toothbrush, or at least continue to wipe the front and back surfaces of the teeth.
When we bring the parents in at that age 1 visit, people ask, well, what do you do at that visit? It's all about education and showing them the signs that they can look for to see where there's going to be early childhood caries before it actually starts.
This is all new, so
yeah,
we're just learning.
Parents have expectations that their child shouldn't cry at age 1 when in actuality it's normal. When they cry, their mouth is open, and I can see and you can see and I can show you what to do and you can watch. They get very comfortable.
Parents want to do the right thing for their kids. They just need to have that information, and we want to get it to them before anything deleterious or anything bad happens. Yep, so today that's what we're going to be doing, is teaching you what to do, how to take care of them.
So don't delay, make that appointment right away. The American Academy of Pediatric Dentistry has a slogan to help remind and reinforce: 1 baby tooth plus 1 dental visit equals 0 cavities.